This is Dr. Andrew Jones. In this edition of Veterinary Secrets, you're going to learn how to tell if your dog or cat has liver disease. Hi there you guys. Before I get into this week's video, I just wanted to give a little shout out to my friend Rob. He was skiing last weekend. He's a great skier, got into quite a serious ski accident, so he's in hospital in intensive care in Kelowna. He's got fractured ribs, fractured vertebrae, broken pelvis, a concussion. So this is to him. Take care, Rob. I want you to heal fast, and I'll be there when you get back. One of the largest and most important organs is your pet's liver. It has a number of important functions, such as digestion, detoxification, sugar storage, breaking down red blood cells, and hormone production. There are a number of different signs and symptoms that you can see with a dog or cat with liver disease. What I'm going to do to start out the video is actually show you the biggest ones and ones I think you should be aware of. Then I'm going to follow that up with some PowerPoint slides so we're not missing anything. So the first big thing, whether you've got a dog or cat, the first big symptom is they just don't feel well. In veterinary terms, we would call it ADR, ain't doing right. Generally, they're depressed, their appetite is off. They seem sick because their liver is affected in some way. So if you just got this dog or the cat, they're just not eating, and they're eating less. The second big symptom that you often can see is something called jaundice. And in jaundice, what you're actually seeing is yellowing of the eyes. You can see this yellow around the white part of the eye is called the sclera, as I'm showing you here on Lewis. You can also see this yellowing of their gums. So Lewis's gums here are quite sort of a healthy light pink color. They would actually, in that case, in liver disease, and if they're jaundiced, they'd be quite yellow. The one other symptom I wanted to point out that we'll often see with dogs and cats with liver disease is that distended belly. So their belly is sticking out, and this is often happening because they've got low albumin, that's a type of protein within their blood. Fluid is then no longer being retained, and it's oozing out into the abdominal wall, into this stomach cavity. So you actually see this big distended, almost sac-like belly. Very common in liver disease. Some of the signs of liver disease. Your pet's appetite is lowered. Some dogs are depressed, lethargic, and classified as ADR, ain't doing right. There can be vomiting and or diarrhea. There can be increased drinking and urinating. Fluid retention, which will show up as a swollen belly. Jaundice, the white area around the eyes and the gums can appear yellowish. A few uncommon signs include neurologic disease, which can show up as circling, head pressing, ataxia, and seizures, and hepatocutaneous syndrome, a type of skin disease, which shows as thickened, crusted foot pads, itchiness, and redness between the toes. This is two different animals which are showing jaundice. A dog on the left-hand side where his lips are lifted up so you can see the yellowing in his gums, and the cat on the right-hand side where you can see the yellowing around his eyes. There are numerous things that can cause liver disease, ranging from tumors to infections. Dogs commonly eat compost, in which there is often a toxin that can cause acute liver disease. Your pet can get a viral infection affecting the liver, hepatitis. Young dogs can have liver disease as a result of a liver shunt, or certain breeds can acquire liver disease due to a copper storage deficiency. Bedlington Terriers, Westies, Keeshonds, and Dalmatians. Common veterinary medications, such as the non-steroidal anti-inflammatories, can damage the liver and result in signs of liver disease. Cats in particular can get two types of liver disease, hepatic lipidosis and cholangitis, cholangiohepatitis. Overweight cats are prone to developing a specific condition called fatty liver, a sudden weight loss which causes the fat cells to permeate the liver. That's also known as hepatic lipidosis. Cholangiohepatitis means inflammation of the liver and the bile ducts, and this is most often associated with cats that have inflammatory bowel disease. Treatment for it often includes medications or supplements to suppress the overactive immune system. So what are the solutions? What can you do at home? So the first step is seeing your veterinarian. If you've got a dog or cat that has many of these clinical signs I've just discussed, such as they're inappetent, they're drinking more than normal, they may have some jaundice, they may have a distended abdomen, we need to get a correct diagnosis. So that means going to your veterinarian, starting out with a basic veterinary exam, and then the first sort of baseline panel is where they're doing blood and urine. From there, we can get a pretty good diagnosis or basis and get a pretty good sense of what type of liver disease we're dealing with, and then follow the appropriate course of treatment. So thanks for watching this video. Thank you, Lewis. And because Lewis has been so patient, he's going to get some extra food. All right. It's one of those little like extra perks of getting filmed all the time. He doesn't really enjoy being on the table, but he sure likes getting the extra treats. Thank you for watching this edition of Veterinary Secrets. What I want you to do now is click that link above. You can subscribe to my YouTube channel, and then when you go ahead and sign up for my newsletter, I'll send you my new special report on pet food, Dr. Jones's advised list of dog and cat foods.